Have you ever felt like you needed a map, a translator, and a miracle to navigate through the healthcare system? Well, today we're going to be talking about how to navigate through the military healthcare system. Hi, guys. Welcome back to Rts Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the Asthma Lady. Yes. Welcome, everyone. Welcome to anyone new. And I'm very excited to be back with you guys. Yes, I have been on vacation. Yes, I've been taking a few more vacations than usual, much needed, but very happy to be back with you guys. And I'm super excited for this episode because we are going to be talking about navigating through the military healthcare system. Yeah, so before we get into that, I want to say thank you to my past guest co-host, Balihan Harris, who spoke on strategic planning in both our careers and our finances. And he really dropped some gems on that episode. So please check that one out. But today I'm very excited because we have an amazing guest co-host, Dr. JoNise Caleb.
Hi.
Yes, Dr. JoNise.
Yes,
Um,
ma'am.
so before I let Dr. JoNise take over the show, let me just give you guys her bio, just to give you an idea of why I had to have her to talk on this topic. Okay, so Dr. JoNise Caleb is a strategic leader with an extensive experience in healthcare operations and program management. She specializes in the development of efficient clinical workflows and utilizing technology to deliver high quality patient care. She has proven ability to translate clinical requirements into actionable solutions that drive performance and improve patient outcomes with a multidisciplinary care team settings. And she is currently the Defense Health Agency Supervisory Health System Specialist, and she's my friend. So, yes, welcome, Dr. JoNise. Yes, again,
Thank you.
very, very happy to have you.
Thank you. Happy to be here. Thank you for the invitation. I love this. And I love what you're doing, the asthma lady. That's how I met you, as the asthma lady. So it's good to see you still doing your thing.
Yes, yes, yes. JoNise, Dr. JoNise, no, I've been doing this for a very long time. Yes. It's
Years.
years, years. Yep. So yes, Dr. JoNise. Now let's talk about the military healthcare system. So, from my understanding, now this world I'm not too familiar with, but I do know that this is a complex system, the military healthcare system, due to things like I want to say because of relocation. We have TRICARE, the just and the structure, I believe, of that system is once again complex. So that's what I know. But I'm inviting you to help us help families navigate through a system that may be a little confusing to navigate through, and just giving some practical tips on how to navigate through the system. So I'm very excited to hear what you have to say,
Sure.
right?
Yes,
So,
yes.
okay, so the first question is for someone new to the military healthcare system, what's the biggest mistake you see people make early on?
Well, let's see. I think, first of all, the military healthcare system is a healthcare system. And I don't think the healthcare system in general is the easiest thing to navigate
Right.
in general, right? And
Yes.
when you keep that in mind, I think the same rules apply, right?
Yeah,
Wherever you go, you want to learn the lay of the land. What are the
absolutely.
rules? How do
Absolutely.
things work? And I think that as a new person coming in, I would just keep in mind that it is its own system. It's a unique system with a lot of similarities, but it's a unique system. And so, as you would do if you're moving to a new neighborhood or, starting a new job,
Mm-hmm.
you take your time and really try to learn the lay of the land. Um,
Intelligence.
just
Mm-hmm.
and I think, once you do that, that is half the battle. Because if you've done healthcare anywhere else, you're capable of doing it in the military healthcare system.
Okay, okay. So can you break down what advocating for yourself actually looks like in this system? So like you said, the healthcare system in general, we know like you said, you got to do your research, like anything else, move into a new neighborhood. And so what does that look like to you when we talk about advocacy within the military healthcare system?
Sure. So again, I will go back to, okay, with a little gnat. I'm sorry about that. I will go back to the initial point of just familiarizing yourself with the system, because that way what's available, your resources, you know what you are entitled to,
Okay.
you know what you may not be entitled to, right? Um, and so you want to really get to know the lay of the land, your resources, and make the most of them. Follow the processes. If this is what you need to do to see a doctor, for example, you need to be assigned a provider.
Okay.
You want to make sure that you take the following steps, because if you
Okay.
don't, it could result in, again, like outside, right? Being charged for things that you didn't expect, because you're
Right.
not assigned, or delays in your care where you thought you made a referral, but because you're not assigned to the provider, there may be some delays in that, because they're not they call them PCM, so primary care managers, kind of like PCPs,
Okay.
right?
Okay.
So they're not
Okay.
in charge
So
of
that's good to know.
managing. Yeah, they're not in charge of managing if they're not assigned to you. So, just things like that.
Mm.
Advocacy as well, again, like anywhere, you want to ask questions. Don't be
Okay.
afraid to ask questions. Um, you want to ask questions to understand your disposition, what's next, what your care plan is. And again, resources that may be related to anything specific to your individual's needs or your child's needs.
Hmm.
And then also, I think it's helpful to provide feedback in real time to
Okay.
the people who you encounter.
Okay. So the
And
care team you're
that's
talking
right.
about.
That's
Okay.
right. Or whoever, right? So if I don't know, or maybe if you had an experience that you felt was overly complicated, sometimes if you explain that to your care team, they can tell you, yeah, this is what you should expect, or no, you didn't have to do that.
Right.
Or
Okay.
did that really happen here? That's not supposed to happen. We're going to escalate that to our leadership or our management, or, whatever, to make sure
Mhm.
that we're able to correct that, or to make it easier, because somebody coming from the outside, you see things differently than somebody who it's normal to us, right?
Hmm. So
So,
I
mhm.
have okay, so you just said a few things and for my FYI too. So does it work like do So, so do you have like in-network providers and outside network providers? And because like there are some insurances where the provider list changes from time to time, sometimes quite often. Does that happen in the military space as well? Right?
Yes,
So
it,
that
it,
like that's so annoying too.
it
I'm
is.
like
So that's what I'm
I'm
saying.
dealing with it with my parents, and yeah, it's okay. So that's
And
a
that's
thing.
exactly what I said. If you've done outside, you can do inside. It's
Okay.
muscle
So
memory,
similar.
but you just have to know, some of the people are different, or some of the terms are different.
Okay,
Um,
because right, you said a new term because you said we have PCPs, but you guys have PCMs.
That's right. That's right.
Okay, so primary care managers.
That's right.
Okay, okay, all right. So good. We learning. Um, so do you guys have like specific um patient navigators, like people who, like, let's say you're new to the military system, like you just, I don't know, you just got married in or something like that.
Mhm.
And so is there someone or like a department you can go to look for a navigator? Does that
So,
exist?
yes, in some way.
Okay, okay,
In
okay.
some way. So, in each facility, I believe, now I have to confess that I am relatively new to this space. And when I say that, I began working for the military health maybe about 2.5 years ago at this point.
Mhm.
A lot of people who work in the system are retired, military. So
Mhm.
even if, in addition to their actual professional experience, they've experienced it as customers, right?
Okay,
But I'm learning about it,
as you
from my
go.
experience the past 2 years, right? So
Hmm.
I just want to say that. But from my experience, each facility has a patient advocate or somebody assigned to that
Okay,
role, right?
okay,
And a
okay,
patient advocate is exactly what it sounds like. And that was actually
okay.
going to be in,
The next,
later
okay, so
comment.
I'm a step ahead because you when you said it, I was like, oh, they have that right. Okay,
Yeah.
okay,
So
I'm
the
a step
patient
ahead.
advocate is exactly what it sounds like. Any questions that you have, any concerns that you have, people usually go to complain. But and I'm actually trying to remove that word from my vocabulary when it comes to customer service because it's feedback. And
Feedback, right? Yes,
complaining sounds so negative,
right,
although
right.
that's what it is, but it's feedback, and all feedback, in my
Constructive
opinion, is
criticism,
is helpful, right?
right?
It's
Uh-huh.
good to know what people are seeing or experiencing on the other side of the table.
Right.
So I'm self-correcting, and that's a me thing, but I'm self-correcting that. So most people go to the patient advocate to give them feedback in terms of just poor experiences that they're having. But the patient
Okay.
advocate is also somebody who's very familiar with, how things are supposed to work and
Right,
directing
right.
you to the resources and just knowing
Correct.
how long this takes and so forth. So,
Absolutely. Okay, that's why I'm asking that question because I feel like, yeah, sometimes you just especially in the beginning, you just need somebody to hold your hands. Like sometimes you don't even know what to ask,
right,
where to go,
right,
and when's the right time to ask.
right.
So I think that is very helpful. Yeah, and thank you for answering that because that's always FYI, even for myself, because I have family members that are just starting to get into that system, so that's why I'm asking for myself too.
Okay.
So yay, we're learning. So what are some common barriers patients or families face, and how can they push through them? So I want to say we're touching on that already,
Hmm.
and you're starting to answer the questions with the patient navigator and stuff like that. So if you have anything additional to add to that.
I feel like my answers are pretty redundant. A common barrier is not knowing, just um, not fully understanding what you have access to, right?
Mm-hmm.
And so when you know that, a lot of times it's a light switch and you kind of know where to go, and some things that you may have been waiting for, or you can quickly access once you know that is the process that you need to have. So just really maintaining situational awareness. That's a term that is used
Situational
in the
awareness.
military a
Okay.
lot, but I learned about it in team steps. So that was before I got to the
Uh-huh.
military in our former
Situation awareness. I
our
remember
former
that. Uh-huh.
employer, right?
Uh-huh.
Linda and I used to work together. So
Uh-huh.
yeah.
Uh-huh. I definitely remember
So
that.
that's right. And so just really maintaining situational awareness, to the best of your ability. And then something that I thought about was just again, situational awareness. So access to care standards, because a lot of times that's what people have challenges with or concerns about. And so I'll just say that system wide, we are supposed to have same day access, right?
Okay.
In our primary care, I should say, in our primary
Same
care,
day access.
we
Okay.
should have
Okay.
same day access. Now, as I am functioning as a practice manager for a facility, and what that means is same day access during the day. But if you call at the end of the business day or towards the middle of the business day, there may not be
Okay.
same day access anymore because people have used that
Okay.
appointment. Okay. So just
Gotcha.
keeping that in mind. And same
Okay.
day access
So
does not
would that be equivalent to just saying like that you take walk-ins? Like you could just
no.
walk.
I mean, you
Okay.
can walk in to get an appointment, but it is appointment based. And so
I
once the
got you.
appointments are used, that's where the walk-in would no
And
longer be.
I
Yeah.
got you. Okay.
Right.
Okay.
And most people don't walk in, actually. They schedule appointments, at least at my facility, over the phone
Mm-hmm.
or through our appointment portal, our patient portal.
Okay.
Um, so, we have same day access, but that may not necessarily be with your provider. Same day access, the assumption is, you need care today. And so you'll see
Get
somebody
somebody today.
who's
Mm-hmm.
available. It may be your provider, it may not be your provider, right? Um,
Mm.
and then same thing for future appointments that's like not urgent or not, something acute. That's within 7 days. We in our primary care are uh that's the measure, that's the standard.
Okay.
And
To see
then
you within the 7 days.
that's right. And then
Okay.
for specialty, which is specialists,
Mm-hmm.
um, within 28 days, right? And so
Okay.
if you're having challenges reaching your specialist within 28 days,
That's pretty
something
good.
that, but something that you should know if you're unable to do it, and especially if you believe that it's something that is, deserving of more
To be
uh,
seen faster.
closer, right,
Uh-huh.
attention. This is something that you can escalate, I would say, to your primary care provider,
Okay.
or better yet, to your insurance provider, because
Okay.
sometimes they can give waivers, right, to see if there are other specialists, maybe beyond the way that it works
Mm.
is there's like a geographical
Okay.
the distance, right? And so
Mm-hmm.
once you get past that, they may be able to authorize you to see somebody a little further out. And if that's the case, then they are likely um, going to allow you to have some kind of access to travel support, financial,
Oh,
to make that happen.
that's good to know. Okay.
So, mhm,
That's good to know. 28 because 28 let me 28 days actually ain't that bad because I used to run the template, the asthma clinic tenant. 28 days is pretty good. If you could get into the
especially,
clinic right
right?
within 28 days. Now, should we looking at 6 months?
That's right. I've
4 to 6 months.
I've waited 9 months for appointments.
Do you, child, it's so mm, yeah.
So
That's why I was
yeah.
like 28 days. I'll take that. I'll definitely take that.
So
Uh,
yeah, that's
that's good.
so pushing through something that I meant to say earlier is don't be afraid to get on the phone, right?
Mhm.
But I would say first, try using websites and the portals, right? Because a lot of times there is information on the website. You don't want to be waiting on hold forever to find something that you could have found on a website. And
Mhm.
portals, I know Humana, that's the TRICARE provider here, but
Okay.
every provider, every insurance provider has a portal where you can find things like where your referral might be. You have
Okay.
access to that information, so you don't necessarily have to get on the phone to find that out. It's only if you have questions about
Right.
what you see
You
there.
have to jump on a call.
That's
Okay.
right. But I
I
would
got
say
you.
don't be afraid to pick up the phone and call. But before you do that, just make sure you've gotten on your portals, you've looked at the websites to see if there's any information there, that
Mhm.
can help you find out what you need.
Okay. Okay. So I want to say you answered my next question. I was because it's gonna deal it's talking about building confidence when speaking up and navigating through referrals and speaking to providers. But you started to talk about, going through the portal. I mean, you'll have all the stuff right there. So yeah, do you have anything to add on to that? Speaking up to providers and whatnot.
Redundant
Right.
in that, but I think it's worth repeating. I think it's worth repeating. So, there are no bad questions, right?
Okay,
So
absolutely.
how do you build confidence?
Keep asking the
You
questions.
That's right. You speak up. You
Speak
speak
up.
up. You do it scared. It's okay. The providers are people, and I think we all
Mhm.
know that, right? But just ask the questions. And a lot of times providers will prefer that you did ask them the questions. Ask away, because that's what the people are there for. That's what we're paid to do, right? Educate
Exactly.
yourself on the process. Educate yourself on the processes and keep track of where things are. Once you get to a place where you're like trying to follow up on something, take good notes
Mm.
so that you can say, well, 2 days
Right.
ago, I
On
spoke to
this
so and so,
day,
and this is what they
yeah.
told me,
Oh yes,
and this is
I
what they
do it.
told me, so that
I
you can
put
kind of
post-its. Yep,
keep
absolutely.
so that
Oh
you can
yeah.
keep pushing things along, that you don't have to keep starting from square one because very rarely do you speak to the same person. Like if you have to
Hmm.
call and follow up on something, very rarely are you going to speak to the same person. And if you do, they may not remember what y'all talked about because it was 2 days ago and
Right.
60 people ago. So,
Absolutely. Makes
um,
sense.
and then let's see. It can be helpful to shorten the response time if you're able to provide specific info. So I guess that's kind of hitched on what I mentioned
Hmm.
earlier.
Writing the
Um,
stuff down.
that's right. If you have
Hmm.
a pharmacy, they have it in the system, but guess what? By you providing this information, they don't have to go look. They don't have to put it on a
Right.
burner to do research. They can go ahead and pop things in because you're providing it. If you have the
That's
name of the specialist and their address and contact, just go ahead and give all the information that you have
up front.
available because sometimes
Hmm.
that could help move things along
Faster.
quickly. And the
Mhm.
last thing I want to say on that is keep your cool.
Yeah. Yeah.
Keep your cool, stay professional, but you can be firm as well, but keep your cool.
Assertive. Right. Yeah. That's
Mhm.
the way to do everything. So
Right.
even if you're a little frustrated, like you said, you could be assertive
That's
and you
right.
can let, whoever is on the receiving end know that, hey, listen, I've called a few times,
That's right.
and I want to follow up. This is where we are. Can you tell me what you see,
That's
on your
right.
end?
That's
Yeah.
right.
So that's usually, oh, child, because I'm the caretaker of a few people right now. So I get it.
Because when you talk about building confidence, what you don't want is to be, when people come at you with a certain energy,
Right. Mm-hmm. It's
right?
it's their job to help, but it definitely makes it you don't want that vibe.
That's right.
Definitely we don't, right.
So in terms of building confidence, you want to present yourself, as yourself.
Yes,
So that
yes,
you
yes.
can, make the necessary connections. You're not necessarily there to be friends, but, just keep calm, keep track of things, to the best of your ability. Know that people are people everywhere, and a lot
Absolutely.
may be happening on the other side as well. Healthcare, no matter where you go, I have learned is notoriously, short staff, right? Like there's always
Right.
something happening in the
Always.
back
Always.
that the
All over
patient,
the country.
that's
Mm-hmm.
right, that the patient is not aware of. And honestly, as the customer, you shouldn't be aware of it. We try not to
Right.
make that the customer's business. But I'm just saying things are happening most likely in the background. So just, keep it cool, but stay professional and firm.
Mm-hmm. I love it. Okay, so, and you know what? And here's another FYI question. Do you guys have a specific, is your open enrollment around the same time as ours open enrollment? When you could change the insurance?
Uh
Is that
yes.
around the same time?
Yes. Yeah.
Okay, okay. Which
However,
is,
the
mhm.
difference would be there is probably more when in the civilian side, you can change your insurance when there's like a significant life event, right?
Okay. Mhm.
So for active duty, you may have more times where there may be significant life events where you may be able to make
Okay.
changes outside of the open enrollment.
That's
So
okay.
yeah,
That's good to know. Okay. And then okay, because one of them, because I'm thinking in my head, I know sometimes military families get relocated a
that's
lot. Would
exactly
that
it.
be considered?
That's it. That's it. Right.
All right, all right.
Right.
We're learning. Because I'm like, how do you? Because I have, like I said, I have relatives, and I'm like, well, dang, you were just in Florida, now you're in Oklahoma, and so how does the healthcare, how does that follow you?
It moves.
Mm-hmm.
But also another thing to remember for active duty, specifically active duty, no matter where you go, they're gonna see you at a military treatment
Mm-hmm.
facility.
Okay.
Because sometimes, you may be like temporarily deployed or what they call TDY. I can't remember what it means. Temporary duty station, something. I can't remember. But
Okay.
basically, you may be on an assignment for a month, right? And if that's
Okay.
the case, once you're active duty, wherever you are, you'll be
You'll be
seen because you're
seen.
active duty, right? And
Gotcha.
that's what we're here for, ultimately.
Okay. Okay. Right. So, okay. So, Dr. JoNise. So, give us a hypothetical scenario, like something. Let's say a patient is struggling to get a specialty care for a child. So, can you like walk us through like where they should start? So, someone's in the beginning, right? So, let's say just got into the military space. They want to take their child to a specialty care. So, where do we start?
You start with your primary care manager, your PCM.
Okay.
Your PCM does
Which
their
oh, which is I'm sorry. So that PCM. So when you're in this space, they're assigned to you, or do you get to choose who's your PCM?
That's a good question. Um, it is assigned,
Uh-huh.
but you may be able to make changes.
Correct.
But initially it's probably going to be assigned.
Gotcha. Okay.
So that's
All
actually
right.
a good question. So yes, sorry.
Go ahead.
Step number
Go ahead.
one is to make sure, and for an active duty and active duty family member, this happens, I think, for the most part, but make sure that you are empaneled to a provider at the military treatment facility that you're looking at. It's probably the
Okay.
only one in the area. There are not a whole lot of them, right? So
Okay.
you want to make sure that you are assigned. Once you are assigned, yes, then you go ahead and schedule an appointment. But honestly, sometimes those things can happen at the same time. But
Okay.
you want to make sure that you get the assignment pretty quickly, so that you can, again, have a manager.
Okay.
And then once your PCM does their assessments, they make their referrals if that's what they have clinically deemed as appropriate. Depending on the severity of it, the patient, at least at my facility, will be assigned to, or may be assigned to a case manager or nursing case manager. So I'm not sure like how if that is something that is prevalent throughout all of the facilities. I'm at
Okay.
a pretty small one, so if we have one,
Okay.
I'm assuming that most do.
Okay.
Um,
So the child, if we're talking about a child, they
mhm.
would get they would get their own case manager,
A nursing case
something like
manager.
a
Yes,
case. Gotcha.
yes.
Okay. Go ahead.
And that person will help also, help you walk through with the referral process and finding specialists. Now,
Mhm.
there's also a program, Exceptional Family Member you know what?
Was
EFMP.
it EFMP? Okay.
EFMP. The first word is exceptional family member, EFMP. But basically the objective of that program is to ensure that, especially for reassignments or deployments,
Okay.
that there is coordination between facilities to make sure
Okay.
that the new assignment has healthcare support, if
Okay.
not immediately, but in the region, that they
Okay.
have some kind of support for the family member who has this uh, more critical health condition. So if you have
Mhm.
a child, for example, with, really oh Lord, I want to say really chronic asthma,
Yeah, you
like a
can say
really,
bad asthma. Yeah, yeah.
okay.
Right.
That's what
You
I
can
want to
say
say.
severe asthma.
Severe asthma. If you had
Mm-hmm.
somebody, with severe, and it doesn't even have to be the child. It could be, the service member. It could be the spouse.
Okay.
But, if you have a family member like that or a mental health issues, things like
Okay.
that, that is a service or a program that supports active duty in their families as they are transitioning to other locations. So that's
Mm-hmm.
something to ask about and to keep in mind as well.
Right. No, that's good to know. So do you guys have something like Epic where you're able to see each, if you're going from facility to facility, they're able to see the easy-ish everything, the medical records?
So internally, all of the middle military health system is on Cerna, a Cerna
Okay.
application that we call
Okay.
Genesis. That's
I
our
got you.
version, but it's Cerna.
Okay. Mhm.
Um, that is something they actually had another system before I got here. Um, when I came, they were about a year into this system. So basically, when
Right.
I don't know if you remember, we transitioned from Quadramed to Epic.
Right, right. To Epic. Yeah, yeah,
That's
yeah, yeah.
right.
Oh,
So
I remember that.
their transition was, I think, from Alta to Cerna.
I got
Um,
you.
and
Okay, just
so
I think I'm just asking to, like I said, FYI, if you're going from a different one facility and then you go to another state and you want to see all another set of specialists, but I think you just said that too, like just making sure the coordinated effort is there to make sure that they.
that's correct. That's
Okay.
correct.
All right. So, all right. No, it's okay. So it's oh, did I stop your step by step? Was that it?
Well, we
I
were talking
think
about the person. Well, I mean, so it
right.
really just goes to, your primary care manager, PCM,
Hmm.
keeping lock and step with them because they are supposed to also be your advocate, on the
Hmm.
clinical end. But through there are supports available that I have experienced, be it a care manager, you have your insurance, TRICARE, or whichever version of TRICARE, that you have accessible to you. There should be some support there. And then you would want to check out your base or your installations EFMP coordinator, because
Hmm.
they may be able to provide some services or provide some support and referrals, connections, so that you know what
Okay.
resources that you may have available to you. Um,
Okay. So like
and
linkage
in
of
addition,
care.
say
Oh,
that,
go
sorry.
ahead. No, I'm saying like linkage of care, maybe a patient navigator or you don't those things, the
That's
in-between
right.
stuff.
That's right.
Mm-hmm.
hmm
Gotcha.
And beyond that, things that we discussed before, keep records of conversations that you're having, tracking where things are. When we spoke last time, this is what you said. Where are we with
Mm-hmm.
this? Really just owning your care.
Mm-hmm. Thank you, Dr. JoNise. Yes, I feel like I learned a lot from this discussion because I think in my head, I'm just thinking like that because of all of the traveling because when I think of military, I think of just
The people,
relocation.
right?
Yes, 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 yes. You're constantly on the move. So I think in my head, I'm like, well, how do you keep everything together? Especially and like we all know, the healthcare system is so complicated already for someone that stays in location for a relatively long time. And so has been very eye-opening. Um, and it sounds like so yeah, so we could do like a recap. So it sounds like well, I'll let you recap if you want to because you know this topic so well. But we start with the PCM.
Yes.
All
Well,
right.
no, you help me on this one. We start with making sure that you are correctly assigned or impaneled.
Assigns.
That's
Okay,
right.
there you go.
So
Okay.
that is the best first step.
All right. Okay. So we have the make sure we are assigned to our PCM. Make sure from with the PCM that we are advocating for ourselves, we are asking the right questions, and we are asking for those referrals, right? And then we are keeping track of everything. We are taking our notes and being able to communicate what happened, following up and requesting, I guess, if you need additional services, a patient navigator, or if you need, well, we said, well, you don't have to ask for the case manager. The case manager might
Be
be a
automatically
part of,
assigned depending on the
correct.
acuity, right?
Okay. And then you can, um, you can change, what do we say? We can have different life circumstances where you can change your PCM. Did I recap
Yeah. Yes, and
properly?
there's one more thing I want to add.
Okay.
Just don't forget to utilize the electronic support available. So if there are portals accessible, you should be using that. Linda, I just thought about it. Sometimes service members we have people who live on ships, right?
Oh,
Right? They're deployed
what
on
does that
ships,
look
right?
like? Right. I didn't even think about that.
Phone
What does
calls,
that look like?
virtual health system.
Telehealth
That's
for the
right.
ship. Okay.
So just,
I didn't even think
the
about that.
electronic access is a real resource. And so we need to make sure that we're utilizing that as
Mm.
as much as possible because it is helpful. Um, oh goodness,
Okay.
I feel like there was one more thing I wanted to add, Linda.
Good.
Oh, and anytime that two more things actually. Anytime
Go
that
ahead.
there is a relocation or a change in your life, circumstances, you're changing your demographics or phone number, marital status, etc. You want to make sure that you're updating with DEERS. Um,
Okay.
DEERS is where all of the information is fed. So
What
DEERS
is?
feeds into your medical record,
All right. Okay.
right?
Good to know.
Um, and so that's important because when people are trying to communicate with you from the clinic, that may be a challenge sometimes because you need to change all of your information from DEERS, right? And so once you do that,
Okay.
it updates in the medical record. Um,
All right.
and military health prioritizes military. And I know that sounds obvious, but it's not only military, active duty family members. It's not just them who get care at those facilities. There are a lot of people who've retired, right? Who
Got you.
are close enough to a military treatment facility, MTF. And so they opt to get their care from there if there is space, on the providers' panels, right? So it's important to know that because one, remembering the priority is active duty and active duty family members. So if things happen where we have to prioritize who we're seeing, right?
Yes. Yes.
Active duty is the most important patient and their family members for reasons that you can imagine, right?
Right. Mm-hmm.
Um, and at military treatment facilities, at mine it's not so much, but others I know it's more where you have active duty professionals providing the care,
Good. Mm-hmm.
right? And again, what that can mean is, you might not have them for too long because of deployment. Their tours are,
Okay. Yeah, right,
a
right.
few months
So,
to a couple of years, right? Um,
mm-hmm.
and if something happens where they have some kind of special assignment, some kind of special training, if they have some kind of, TDY, as I said, they may have be assigned to go somewhere for a month or 2 months, that
Mm.
can impact your continuity. So just keeping those things in mind as well.
Okay. Right, right, right. So it might be a little disruption in the service, or you might have to get someone, a different provider
That's
at
right.
that time.
But the good
Wow.
thing is
Okay.
that we have the electronic medical record system. So,
Mhm.
for the most part, it's not the same, obviously, as, having a one-to-one
Mm.
conversation with someone, but also they do have some kind of orientation to,
Okay.
what the patient is needing. And
Got
so
you.
you don't have to start from scratch
Stretch.
because there's something in the
Okay.
system that can speak to, your
Mm-hmm. The
prescriptions,
history.
that's right, on
Mm-hmm.
a very high level. So,
Okay, no, that's a good one. Yeah, because once again, not being that familiar with that world, that
mhm.
space, that's something that I would not think about. Yeah, but that does make a whole lot of sense.
Yeah.
Absolutely. That makes
One
a
of
lot, a
one
lot
of the
of sense.
themes that we have is I want to say it correctly. I'm probably gonna chop it up, but um, the purpose of the military health system is to make sure that not only are our military healthy enough to serve
Mm,
and ready to be deployed and stuff like that, but also that the military members who are trained professionals that they have training, so that they can keep up their skills. So we want to
okay.
make sure that that's what it is, medically ready and medically ready in terms of the soldiers and also ready to provide medical care, right? And
Hmm.
so you have all of that happening at a
All
military
at the
training.
same time. Okay. Listen. Dr. JoNise, thank you so much for giving us those insights. I frankly I've learned a lot. So I think the listeners will learn a lot. I think you definitely gave us some gems for those of us that are new to the system, to that space. And yeah, you definitely made it eye-opening for those of us that are not familiar with the military healthcare system. So thank you. This is your opportunity to plug away. How do we find you? Do you have anything going on? Plug. I'm definitely going to put your social media handles, and all that good stuff in the description.
My only I- my plug is the social media. Please feel free to connect with me on LinkedIn.
Okay.
I am working on some things, that, this year I hope to make everybody
Uh,
know about. But for
okay.
now, just let's connect. Let's
All
connect.
right. I love it. I love it. Well, thank you so much, Dr.
Thank you.
Jodise, for
Thank you,
being here
Linda.
with us. You did amazing. I really did. I really learned. I really
Good.
did. Truly, truly, truly. I appreciate you so much.
Thank you,
Guys,
Linda.
thank you. Guys, thank you so much for being here with us. And I hope you learned something here today. Please be a part of continue this conversation. Let us know, what are you seeing? Are you a military family? Are you someone, do you know someone that serves and had this issue navigating through the healthcare system? Please feel free to be a part of the conversation. We are here on most podcast platforms on Wednesdays, except for when I'm on vacation. And we are on YouTube on Thursdays. So much more to come. All right, guys. Until next time.